area in the orbital cavity will contain the lacrimal gland and the eyeball in it. Now this whole of the orbital cavity has been shown here, the orbital cavity, okay? The orbital cavity containing the eyeball in it. With the eyeball, this yellow color structure that you see are the fat. Fat which is going to support the eyeball and the structures in the orbital cavity. This side has been removed. This lateral side, the bone has been removed from here to make you visualize the inside of the eyeball. As far as the practical is concerned, you just need to identify few of the structures, okay? You just need to identify few of the structures. But for understanding your lecture, I have to do some of a little bit detail so that you can easily understand this. What we have in the orbital cavity, other than the lacrimal gland, the eyeball, you see the extraocular muscle. Extra means outside. Ocular word is for eyeball, and muscles are these, okay? As I told you in the morning, these muscles are 6 muscles, out of which 4 are straight muscles, while this one coming obliquely and another one, this one, 2 are oblique, a superior oblique and an inferior oblique, while the straight muscles are superior rectus, lateral, medial and inferior rectus. Okay, 4 are straight and 2 are oblique, total 6 extraocular muscles. Between the muscles here, you can see there is a nerve running. This nerve is called as optic nerve. Optic nerve going to the eye, okay? Here you can see the lacrimal sac. Lacrimal sac is visible here, which will collect the tears in it and then send it to the nose. This lacrimal sac, from this area, it goes till the nasal cavity to shed the tears from there. This is what we see in the orbital cavity. Here, then we come to the eyeball itself. Eyeball, I told you there are 3 coats. The outer coat is fibrous. It has 2 parts, cornea and the white color one, sclera. Cornea and sclera are 2 parts of the same outer coat. Anteriorly, this cornea is transparent, so the light can come in, while the sclera is opaque because we don't need light to enter from here, only we need support. As you remove the sclera, below the sclera you see the vascular layer, the middle layer which is called choroid, okay? And from this vascular layer, the brown color one, anteriorly is coming some muscles with which is hanging the colored part called iris. Okay, iris. Iris lies behind the cornea. Behind the cornea is the iris. Okay, this iris is continue with the second layer, the choroid. And innermost, the third layer that we see, the innermost third layer having the nerves is called retina. Okay, retina. So 3 layers, sclera, that is sclera and cornea, then choroid, and then retina. You can see that the second layer, which is choroid, has anteriorly the iris, the colored part, and also it has fibers to hold the lens. The area between the cornea and the lens is called aqueous humor. And the area between the lens and the retina is called vitreous humor. Aqueous humor is an area where the liquid or fluid is present. Vitreous humor is the area where a gel-like substance called vitreous humor is present. This fluid is more watery, this one is like a gel. This will give shape and this is just for nutrition. The aqueous humor is divided by the iris into an anterior part which is between cornea and iris and a posterior part which is between iris and lens. We call it anterior chamber and posterior chamber. These details you need for the theory. Then we can see that the optic nerve coming from behind is opening in the retina. Here in the retina. This area where we have the optic nerve opening in the retina, this is called as blind spot. You cannot see anything at this area, blind spot. You can, if you stretch your thumbs straight and keep looking at these thumbs, don't move your eyes, just move one of the thumb. A point will come where you cannot see this thumb while looking at this one. This is called the blind spot, the point where the optic nerve is entering the eye. Okay, the physiology people, I think, will do this test with you. Or they should do it because we learned it in physiology. This is all about the structures. Now the important structures regarding just as the practical, you need to identify the cornea, iris, sclera, choroid, extraocular muscles, optic nerve. If you identify these, this is enough for your practical. But just to make you understand what we did in the morning is to look at all these structures. Can you go inside and bring one of the head like this from the torso, which is having a lacrimal gland here.
Okay.
There is a gland, yellow color gland and eyeball in it.
Okay.
Eyeball and lacrimal gland. Bring the whole head only, okay? The head only. Then, any question here? Identification of what we need. Identification for the layers. Cornea, sclera, choroid, retina, okay? Then iris is the front part. Then optic nerve, extraocular muscle. Doesn't matter it is medial or lateral or superior, but if you identify that this is an extraocular muscle, this is enough. And lacrimal sac you can see, optic nerve you can see. These are the important points of identification for practical only. The details needed only for the theory, okay? Not more than that. Then if there is any question, you will ask, otherwise I'll proceed to the ear. Okay. Similarly, the structure of ear, you all know we have three parts of the ear, the place where you are sitting. I know that they are not looking at me, but still when you are sitting, they can, even if they want to look at the model, they will not be able. Change your seat.